Welcome. Welcome to Therapy Notes. This is a site dedicated to exploring issues, concerns, concepts, topics that I have worked with over the years of being a therapist. This is not meant to diagnose or treat any mental disorder, and it's for information and educational purposes only. Self-esteem. Wow, that is a very big topic, very important topic. Self-esteem tends to be part of most people's therapy, although sometimes it's not the centerpiece, but it certainly is something that most therapists assess because it really impacts how a person deals with life and contributes to some of the difficulties that may be going on in their life. So it's really important to assess that. So you might say, well, what is the big deal? What is the self-esteem issue? What is self-esteem, right? Some people don't, haven't either heard of it or don't know exactly what it means. So it's essentially, it's how I feel about me, right? Self-esteem is how a person views their own self-identity. Okay, so how I esteem me doesn't have anything to do with anybody else. It's really an internal assessment, and it's on a continuum. You can have very, very low self-esteem, or you can have very, very, very robust and high self-esteem. I don't like the term high self-esteem. I don't use it when I work with people. I tend to talk about low self-esteem and healthy self-esteem. And this is my reasoning. I have seen over the years that people they know the term self-esteem and they have some concept of what self-esteem is, but they view high self-esteem as people who think they're better than other people, who have an overabundance of confidence, who are on the surface almost arrogant about how important they are. They have a self-inflated view of the self, so they tend to be more aggressive. They tend to look down. They tend to think of people as on a measuring stick, right? You're worth more, you're worth less kind of thing. That's not actually healthy self-esteem. And in fact, and I'll do a video on this, that level of inflated self is probably a mask. It's probably a mask. It's hiding something. So healthy self-esteem tends to have the view that you look neither up nor down on anyone. So wrap your mind around that one. That's a fascinating topic, and I'll probably do a video on that. But healthy self-esteemers look neither up nor down on anyone. They have a value of people at their core, and that's how they use to assess themselves and other people. So it's an accurate assessment. It's an accurate assessment of their pluses and minuses, their weaknesses and their strengths, their experiences, their capacity to learn. They tend to have a pretty robust view of the self that is balanced. Okay, so think of it like that. They have a balanced view of the self. They don't inflate how important they are, but they don't deflate it either. They don't look at themselves as not as good as other people. They don't carry around a yardstick saying, am I good enough? Am I good enough? Or they don't shrink and say, I'm not good enough. I'm not good enough. So it's on a continuum. There are people with extremely low self-esteem, and there are people with extremely healthy self-esteem. Because it's on a continuum, there is low self-esteem can be sort of mildly low. They get along mostly in life. They do okay. All things considered, they can have relationships. They get through hard times, whatever. but it does tend to get in their way of some things. But very, very low self-esteem. I mean, very low self-esteem, especially in men, but again, it isn't a gender thing, tend to be very self-destructive, self-defeating. They tend to have habits and behaviors and reactions that make relationships very difficult. They tend to have difficulty learning from their mistakes, because to them, and again, this is a separate topic because this is more complex, but mistakes to them are an indictment against the self. I'm a horrible person because I made mistakes. And since I don't want to be a horrible person, I have to bury those feelings of worthlessness. And so you can see how the lower a person's self-esteem is, the harder and harder it is for them to get out of their own way. They tend to be very self-defeating, and that gets really in the way of gaining ground or insight into their behavior. But moderate self-esteem issues, like I said, a lot of people find ways around it. Some are okay, some of them are not necessarily okay, and we'll have plenty of time to unpackage that. But healthy, robust self-esteem tend to cope better with life's ups and downs. They tend to have more stable moods, so they don't get down on themselves as much. There are times when they do in inappropriate ways. But most of the time, they try to learn from their mistakes. They try to control their own actions, and they assume that not everybody's going to like them, and that's okay. They're accepting of the fact that they can't make everybody like them, and they work hard when they have disagreements with people they care about to try to find solutions to difficulties. It's very hard to offend a person with healthy self-esteem. They tend to use a benign intent format, which again is a separate issue that we can talk about, or I can do a separate video on. But yeah, they tend to see the good in others, or assume the other person means well. They don't tend to have a jaded view of others. They don't tend to have a cynical view of others. Because they don't have a cynical view or jaded view of themselves, they tend to bring that into a relationship and work hard to try to find common ground. So healthy self-esteem, they tend to have better relationships. They set goals and they achieve them more often than not. They have very few self-defeating behaviors. They work well with others. They can work alone. They're not afraid to ask for what they need. They know that the answer sometimes can be no, and that's okay. They give freedom to others to kind of have choices. They don't assume that if relationships don't last or fall apart or are not don't work out, it isn't necessarily that they're a bad person. And they learn from their mistakes. So if they do make mistakes, they're eager to find a way to use them productively. And so that's why we work so hard in therapy, to help a person address the self-esteem, because we know their mental health and the quality of their life is going to get much better if they do address that and they do work through whatever's holding them back. We know totally a full 10 videos on how we talk to ourselves in our head, how we speak to ourselves in our head, the words that we use in our head. Words have power. How we talk to ourselves and what words we use in our head, what we call the inner critic, is really powerful in shaping the perception of the self and ultimately relating to our self-esteem. So that's a whole separate issue that we'll get into. So yeah, self-esteem can be improved. If you are struggling with self-esteem, if you are always down on yourself, you're always critical of yourself, you talk bad to yourself in your head when you make a mistake, all those things, that can be improved. That can be improved, and life can feel much easier, and you can get a lot more satisfaction and quality of life by working on self-esteem. So self-esteem, pretty important, really worth working on. Thank you for coming. I hope you found this informative. If there are issues or topics that you'd like to see me talk about, please put them in the comments below.